How many people are scared to do exercise now? How many people are ready to do exercise? I should say scared into doing exercise.
Is that assuming she's eating the same things?
It's assuming everything else remains constant. Yep.
She has the same diet.
Because nutrition, in essence, isn't going to change your body fat or your muscle mass. Even though you're eating healthier, it's really calorie for calorie. Now, it does a whole lot of different things for cardiac risk factors and developing different types of diseases. But just nutrition alone, if you're not doing anything else, you can still gain more body fat and lose more muscle mass. So benefits of aerobic training. It can reduce health risks. So number one is obesity. We like to say in my department that if we could bottle up exercise, it might be the miracle pill to reduce a lot of things in life. If people wanted to take a pill, we would give them an exercise pill because it really reduces the risk of so many diseases. So not only cardiac disease, but strokes, diabetes, high blood pressure, you name it, it can help reduce a lot of different diseases, even cancer. Studies are even showing more now that cancer patients benefit from some sort of rehabilitation to really help metabolize out some of the effects of the radiation and chemotherapy. So physical activity is an important part of an overall healthy lifestyle. Improves mood, reduces your risk of several chronic diseases, strengthens the heart and lungs, and promotes better sleep. I will say for me, that's number one for me. I sleep really good when I have good exercise days. And if I don't sleep as well. It just really, it settles in me to have a good night's sleep if I've had a great exercise session in the day. And I exercise in the morning. It's my favorite time to exercise. Some people like to exercise in the evening. How many people are morning people here? And how many are evening people? And so you do what works best for your lifestyle. I like to go to bed at 9:30, 10 o'clock at night. I'm one of those people, and so I would rather get up at 5 in the morning and do my exercise. It's when I feel my best. When I come home, I have 3 children. They're in soccer and basketball and homework and you name it. I know that I'm not going to end up doing it if I'm exercising if I choose to exercise in the evening. Whereas at 5 o'clock in the morning, they're still in bed. So I know that I can get up and I can have my time, my peaceful time to go and do my exercise. There might be 1 or 2 that get out of bed that early, but they get sent back to bed. So benefits of resistive training. For every pound of muscle you gain, you'll burn an extra 35 calories per day. That's a lot. So you think you put on 2 extra pounds of muscle mass, you burn an extra 70 calories a day. You know, that's half of a candy bar, or that's, you know, it really is, if you look at it in numbers, it's pretty significant because it only takes 2 calories per day to maintain 1 pound of body fat. So you look at the difference. 1 pound of body fat, 2 calories. 1 pound of muscle mass, 35 calories. It's a pretty significant difference. So increased muscle mass would mean an increase in resting metabolism. So that's what we're talking about with that basal metabolism. If you have more muscle mass, your basal metabolism is going to go up. So if you get an extra 5 pounds of muscle mass, it's a pretty big deal for burning extra calories, and you'll see that fat mass go down over time. Assuming all else remains constant, and this is where the nutrition comes in. If you exercise, you can't go out and have an ice cream cone, because what have you done? It's pretty much negated what you've done, right? You've burned 200 calories, and now you've just had a 350 calorie ice cream cone. So now you've taken in more calories than what you've burned. So you have to take that into mind. Just because you exercise doesn't mean you can eat a whole lot more. You really should be eating about the same. So additional benefits: reduce susceptibility to falls. Again, very important, especially with that bone mineral density. If our bone mineral density stays up, even if we did fall, we're going to have less likelihood of developing fractures, especially in the hip area, or having to have the knee replacement or the shoulder surgery. It really helps reduce low back pain, arthritic pain. They used to say when you had arthritis, don't exercise. We are now realizing there's so much more benefit to exercising if you have arthritis. You just find what doesn't hurt so much for you. So if walking hurts a lot, you try a bike or you try to get in the pool. Resistive training is very important for arthritis because it builds up the muscle around the joint that has the arthritis around it, so it's more stable so you can move throughout your day. So very important to continue with the strength training. It also increases physical and mental well-being. So what should you always do before you start exercising?
Warm up.
Warm up. Should you stretch before or after exercise?
Both.
After. Do you want to stretch a cold muscle? What would happen? Injury to that cold muscle. The tendons are tight, the muscles are tight. I always say, think of it like a steel bar. Your muscles, when they're cold, are not flexible. But when they're warm, when you've used them for a while, when you've started exercising, they're more like a rubber band. So you can actually stretch them more. That's where you gain the most flexibility. Now it's okay if you start and do 5 to 10 minutes of a slow activity during warm-up. You've gotten your muscles a little bit warm to do a little bit of stretching. But I would never overstretch before activity. I would always stretch afterward.
What does not static stretching mean? 5 to 10 minutes of slow activity, not static stretching.
So static stretching is like a hamstring stretch where you would just go down and stretch your hamstring and you would just hold that for 30 seconds.
And you don't want to do that.
You don't want to do that. Dynamic movement. So dynamic movement means you're moving, you're doing leg lifts, or you're lifting your arms up and down, or you're doing a slow walk before your faster walk. You can mimic the activity that you're going to do, but just do it at a slower pace. So that's really what a warm-up is. Static stretch is something you don't want to do. You don't want to be stretching before your activity. This increases blood flow, so that really helps, especially with those who have any type of disease, to distribute the blood flow, so it helps reduce angina for cardiac patients. It really helps with diabetic patients. It prepares them so that they don't go into this crazy insulin. You go from high to low just like that. It really gets things, it prepares your body for the activity. Slowly increases your heart rate. Do you think your heart would rather slowly increase or start like that?
Slow.
Slow, exactly. You're more susceptible to arrhythmias, especially if you have known heart disease or a lot of risk factors, if you would just go out and start really quickly. Always good to start very slowly and then gradually get faster with time. This does help. It increases flexibility, loosens joints, and it mentally prepares you for what to come. When I go out at 5 o'clock in the morning and I step outside, my first step doesn't want to be a jog. I need to think about the fact that I'm going for a jog, so I might walk for 3 or 4 or 5 minutes first and then start the jog. So it's just that mental preparation. It actually is preparing your body to go into that activity. You should do this before doing any strength training as well. A lot of people in the past, if they think, oh, it's just a strength training day for me, I'm not doing any aerobic activity, I can just go in and start lifting weights or do the TheraBand exercises. You should always warm up because, again, your muscles are cold. They're not going to like the fact that you're just starting a strength training routine if you don't warm up. So you should always warm up, even if you're only doing resistive bands, at least 5 to 10 minutes before you start doing them. So we use the FIT principle. How many people have heard of that for cardiovascular exercise? So frequency For cardiac benefits or cardiovascular benefits to help your heart, to reduce stroke, the risk of stroke, to reduce the risk of cardiovascular disease, you should be exercising a minimum of 3 times per week. And you don't gain a whole lot more benefit from cardiovascular disease from a cardiovascular standpoint if you do 5 times per week. You do gain other benefits, other physical benefits if you do more. So I always tell people, if you really want to get 3 days in, you should always shoot for more. So I always shoot for at least 6 days of exercise. So I know that I'm at least going to get 5 days in. Because something inevitably comes up on one of those days. Or I just can't get myself out of bed one of those days. So I leave a little room for flexibility of the days that I choose to exercise. If you really are good at scheduling yourself, you can schedule the 3 days if that's all you want to do, but you have to stick with that for cardiovascular benefits. 2 times a week only really maintains what you have. It doesn't do a lot to improve your cardiovascular risk factor. So 3 times a week is really the minimum. So intensity, 50 to 85% of your VO2 max. Well, how do you measure that, right? How are you going to know what that is? A lot of people are on medications that they can't figure out what their appropriate heart rate is. If you're not on any cardiac medications, you can figure out what your maximum heart rate is by taking 220 minus your age. And the easiest way to figure out where you should be is to multiply that by 0.5 to 0.9. Anywhere in that range. If you're not a regular exerciser and you want to get into an exercise routine, you want to start at that 0.5, 50% of your maximal heart rate. If you're an avid exerciser, you can get up to that 85%, 90%. Again, if you're doing that 85 or 90%, you're not going to sustain that for a long period of time. So higher intensity, less minutes of exercise. Lower intensity, more minutes of exercise. I typically am probably at 70%, and that I can sustain that for about 40 minutes, 70 to 75%. That is right at the moderate intensity range, so anywhere between that 50 to 85%. Now, if you're on cardiac medications or anything that's not going to get your heart rate as high, say something like a beta blocker, you want to just go by how you feel. Use the talk test. What's the talk test? I can talk while I'm walking, but it's a little bit hard. I might need to stop every once in a while and take a good breath. That's about the intensity that you want. If you can sing, are you working hard enough? No. You have too much oxygen to utilize to sing. You're not working hard enough. If you can't talk and you're having to pant because you can't keep up, you're working too hard. So the talk test really works well for that. Time is 20 to 60 minutes. So 20 minutes, if you're not a regular exerciser, start with 10-minute bouts. Anything is better than nothing. Do 10 minutes in the morning, 10 minutes in the afternoon. And then as you feel better, you can clump that into one 20-minute exercise. Studies are showing that intermittent exercise, doing 10-minute bouts a couple times a day or 3 times a day, is just as beneficial as doing one segment of exercise. So it's a good thing for people that they don't feel like they have to do it all at once. If you know that you need to, you can only get in 10 minutes at one time, break it up throughout your day. I think for your best benefit still, if you can get to the continuous exercise, getting to that 40 minutes. 40 minutes is great. It's what we push all of our cardiac patients to get to, is 40 minutes of continuous exercise. I think that is a bit more beneficial than just doing 10-minute bouts here and there.